This is going to be a very painful 2 weeks.
Who else has to die for you to understand you have a responsibility in this?
Most of us are fighting back our tears.
We are seriously desperate.
This is the most important mission I've ever been on.
Good morning and welcome to Sunday Today on this April 5th. I'm Willie Geist, working remotely this morning, just as so many of you are these days. President Trump is warning of what he calls the toughest week ahead in our country's coronavirus crisis, and new overnight numbers tell us why. The death toll in the United States rose by more than 1,300 in the past 24 hours, with more than 300,000 people infected. 113,000 of those are in New York State alone. New York Governor Andrew Cuomo reports New York City's peak is about a week away by expert estimates, and the president now sending more than 1,000 medical military personnel to help out the city's strained hospitals. And tonight, a rare televised address from Queen Elizabeth, only the fourth of her long reign. Her Majesty reportedly will tell the United Kingdom she hopes people will say someday, quote, Britons of this generation were as strong as any. We will have much more on those stories and talk to Chuck Todd in just a moment. Then our Sunday spotlight on this Palm Sunday, as an unprecedented Holy Week begins with empty churches and synagogues, but with the faithful intent on congregating one way or another. And in our Sunday closer, Harry Smith salutes America's extraordinary teachers who are getting creative to bring the classroom into our homes. And later, one of our favorites from the Sunday Sit-Down Library with actor Ryan Reynolds on the wild success of his Deadpool franchise and why he decided to get into the liquor business like George Clooney before him. Did you talk to George about this? Did you say, hey, I noticed you did pretty well on this. Is it a good business to be in?
Yeah, he hung up on me almost instantly.
A Sunday Sit-Down with Ryan Reynolds, plus another life well lived, all a bit later in the show. But let's begin this morning with the latest on the coronavirus pandemic. New York City now preparing for an expected surge of cases within the next few days. NBC's Kathy Park is outside the Javits Convention Center in New York, which has become a makeshift hospital to treat COVID-19 patients. Kathy, good morning.
Willie, good morning to you. In addition to the 2,500-bed Javits Center behind me, 1,000 military doctors, nurses, and support staff are all coming to New York City to help during this ongoing crisis. And while all these resources are coming together, there's growing concern that it's not happening fast enough.
This morning, alarming new numbers as the global pandemic reaches a grim milestone in the U.S. More than 1,000 deaths in the last 24 hours. President Trump preparing the nation in his daily briefing for what's to come.
This will be probably the toughest week between this week and next week, and there'll be a lot of death, unfortunately.
In New York, Governor Andrew Cuomo says the peak could hit in a matter of days.
We're not yet ready for the high point.
But help is arriving from around the world. 1,000 ventilators from China, 140 more from Oregon. Plus, 1,000 military members will deploy to New York City as they plead for more supplies and medical workers. The president says federal resources will be allocated to other hotspots as needed. With social distancing guidelines in place by the CDC through the end of the month and more than 300 million Americans staying indoors to slow the spread, President Trump signaled that he's looking at ways to reopen the country.
We cannot let this continue. So at a certain point, some hard decisions are going to have to be made.
And stressed the need to reschedule major sporting events sooner rather than later.
You know, they want to see basketball and baseball and football and hockey.
But the nightmare is far from over for the 1,900 passengers and crew on the Coral Princess.
2 of our guests passed away last evening while being treated in the medical center.
The cruise ship is now stuck at Port Miami with at least a dozen positive cases on board. But amidst the chaos, signs of community when we need it most. Our healthcare heroes in New York City serenaded with sirens of gratitude.
And in more news that we can smile about, 85,000 healthcare workers have volunteered here in New York to help with the ongoing pandemic. 22,000 are coming from out of state, but here in New York City, there's still a growing call for more medical personnel to sign up. Willie?
They need all that help. Kathy Park in New York City starting us off. Kathy, thanks so much. Let's bring in Dr. Calvin Sun. He's an ER doctor working in hospitals across New York City. Dr. Sun, thank you for what you're doing, and thank you for taking time to speak with us this morning. We see the statistics, we see the graphs. Everyone's trying to flatten the curve. But you're on the front lines. You are in these New York City hospitals, and you've been in a bunch of them. What is your report from what you see, let's just say yesterday, inside those ICUs and emergency rooms?
It just feels that we can only compare it to what it was the day before. It's all relative at this point. Is it worse than yesterday? And do we have more death? And what I'm seeing is that things are sometimes getting worse and then sometimes getting better, just like how it is always in New York City, where every day just gets progressively worse in terms of people are younger and sicker, and we see manifestations of COVID-19 in ways that we never expected, such as reports of stroke and other conditions that have nothing to do with respiratory symptoms that are now associated with COVID-19 in younger and younger patients. More people who die in emergency rooms waiting for a bed upstairs. But at the same time, there's also now we're seeing help. We're seeing New Yorkers responding to things. We're stepping up to the challenge and rising to the occasion with new field tents being set up and finally in operation at full capacity. And other hospitals are taking patients, transferring them over. So these are all signs that there's a response, and we are going to meet up to the challenges that COVID-19 may present to us.
And as we talk about the human face of what's happening inside the ICU, I know you, Dr. Sun, this is something other doctors have had to face too, had to intubate one of your colleagues, a nurse who was a friend of yours, and she later died. Can you tell us about her, Dr. Sun, and what that was like for you?
To clarify, it was a nurse that works at a hospital that I used to work in, and I particularly do not choose to treat people that I know personally because that creates a bias. So she was a colleague, and it doesn't matter if I knew her or I didn't know her. It was someone that worked alongside with me, and she's one of countless other faceless frontline healthcare workers that I've been in contact with and not only worked with, but then a few days later was in my emergency room and was being treated by my staff and a team that I led, and some of who do not make it, and some of who are critically ill, and some of whom we had to replace. And frankly, some of my shifts I'm gone on because some of my colleagues are calling out sick or hospitalized, and I feel like that I'm going to be next. And it doesn't matter who it was with who I was treating. It's just the fact that she was all of us, and we're all of them, in that we're doing our best, but we don't know when's it our time to face the consequences of, dealing with this every day and not, feeling like we're completely safe.
Dr. Sun, I'm so sorry about your colleague. I'm so sorry for what you're doing, but I just can't express enough the gratitude, not just for me, but from the entire country watching this morning for what you do each and every day. Thank you, Dr. Sun. We look forward to talking to you more as this goes on, and we wish you good health, sir. Thank you very much. While President Trump was giving his daily coronavirus briefing to the media on Saturday, he also was pressed about his decision to fire the intelligence community's inspector general, who helped to trigger the Ukraine investigation that ultimately led to the president's impeachment. Also asked about the removal of a Navy captain who sounded the alarm about coronavirus on his ship. NBC's Kelly O'Donnell is at the White House with more. Kelly, good morning.
Good morning, Willie. Beyond the sober talk about the pandemic, the president also lashed out over two prominent and controversial firings in his administration. First, President Trump defended his, quote, absolute right to fire the intelligence community's inspector general, Michael Atkinson, who the president blasted as a disgrace. Atkinson turned over to Congress the whistleblower report that led to impeachment. Democrats have defended the IG for following his oath and called the president's action a reprisal. The president's fury is still very raw.
I thought he did a terrible job, absolutely terrible. He took a whistleblower report, which turned out to be a fake report. It was fake. It was totally wrong. It was about my conversation with the president of Ukraine. He took a fake report and he brought it to Congress with an emergency, okay? Not a big Trump fan, that I can tell you.
And turning to the Navy captain relieved from his command this week, but cheered by his sailors from the aircraft carrier, where nearly half of those sailors contracted coronavirus. The president said he agreed with the military's decision to remove Captain Crozier and criticized him for writing a letter about the outbreak on board the aircraft carrier. The president called that inappropriate. Willie?
Kelly O'Donnell at the White House for us. Kelly, thank you very much. Chuck Todd is NBC's political director and, of course, moderator of Meet the Press. Chuck, good morning. Good to see you as always. Let's talk about the president's approach to this coronavirus national crisis that we're all living through every day. The failures leading up to today have been cataloged, but let's look at where we are right now in terms of a national strategy. You have governors bidding against each other to get ventilators into their states. You have Governor Cuomo from New York reaching out to China to get ventilators into his state and into those hospitals like the ones where Dr. Sun is working. What exactly is the national strategy as of this morning to go after coronavirus?
It's a lot of recommendation, it's a lot of guidelines, but it's a lot of states' rights, it seems as if. I mean, you know, the other part of this that has been disconcerting is watching Drs. Fauci and Birx and Admiral Adams, the Surgeon General, all are making more concerted pleas to the public on social distancing. Perhaps, you know, there's been confusion on the mask issue, and we can set that aside. But if you really think about Fauci wondering, look, I know there's a states' rights argument, but I don't understand why everybody's not locked down. Or Dr. Birx saying in front of the president, we're not bending the curve. Please, we've got to do more social distancing. And he just stands there. So it's been a lot of that on the one hand, on the other hand, mixed messaging. And I think it has led to this idea that the federal government is basically sitting there going, look, we're going to be a backstop. And right now they're leading like they're a backstop and only a backstop.
Yeah, every time Dr. Fauci went on television this week, he effectively said, yeah, we should have a national shutdown, but there's an argument for states' rights that I'm not going to get involved with. Chuck, there is that hope versus reality thing that any president has to do, and we understand that. The president floating again yesterday, the idea that we got to get those basketball games going again. People want the NBA. I'd love to somehow get people able to congregate for Easter. How does the president balance the reality of this crisis with projecting hope to the country?
Look, I don't know. He is always wanting to be an optimist, a cheerleader. He has said that himself. He used to criticize President Obama, mostly sometimes because he didn't, quote, cheerlead the economy, even if it wasn't there. I do think in a moment like this, the president is misreading the public's appetite for optimism. We're locked in our houses, okay? We know this is a serious thing. Don't try to tell me something that isn't true. Tell it to me straight, Doc, you know, is sort of the mindset that I really think the public's in. I think that's why governors are getting so much more approval from the public, because the governors have been giving you the bad news. They've been telling it to their constituents straight. I do think the president would actually be helped if he did that.
And Chuck, we can only hope that this morning on Meet the Press, your dog will be co-hosting as he joined us this morning on Sunday today.
I do have yes, it was my younger dog who he has a lot to say about this pandemic. He's not happy about all the extra company he's had. Yeah.
Very vocal on this issue. Chuck, thanks so much. We'll look, of course, for more on Meet the Press when Chuck is joined by the U.S. Surgeon General, Vice Admiral Jerome Adams.